Hey everyone, my name's Claire and I'm an intern here at Williamsville, and today I am going to just briefly go over some of the 10 most common misconceptions when it comes to addiction. So myth number one is that addiction is a bad choice. A lot of people have a misconception that addiction results from weak willpower or a lack of morals. This is not the case. Myth number two is that people must hit rock bottom to recover from addiction. You don't have to have dire consequences occurring in your life to be able to be ready for recovery. Myth number three is that addicts could quit anytime they wanted. As Mark Twain said, giving up smoking is the easiest thing in the world. I know because I've done it thousands of times. So addiction changes our brain chemistry and makes quitting a lot more difficult. Myth number four is that only certain types of people get addicted. Addiction happens to anyone across and does not discriminate by age, ethnicity, gender, or socioeconomic background. Everyone is susceptible to addiction. Myth number five is that alcohol is less dangerous than other drugs. Even though alcohol is legal, it's just as harmful and addictive as other substances. Myth number six is that relapse means that treatment has failed. Addiction is a chronic and relapsing condition, and just means relapse means that there might be a setback that's occurred and the treatment plan may need to be adjusted. It does not equal failure though. Myth number seven is that dual diagnoses, which means having both a substance use and psychiatric disorder, are rare. It's actually the opposite. It is very rare to not have more than one diagnosis when it comes to substance use disorder and other mental health challenges. So it's pretty common for that to be the case. Myth number eight is detoxification with medications is not necessary. Detoxification can actually be dangerous potentially on your own and can lead to different withdrawal symptoms depending on what substance you're withdrawing from. So medical supervision sometimes is necessary to keep you safe. And myth number nine is if addiction is a disease of the brain, why don't we have a cure? And although there is not a cure or a one-size-fits-all approach to treating addiction, there are a lot of different evidence-based treatments, interventions, and things that we can do to help people who are struggling with addiction maintain and achieve recovery and sobriety. And then finally, myth number 10 is that medication-assisted treatment replaces one addiction with the other. There are actually a lot of safe medical treatments that can help with reducing cravings and then preventing relapse. So that's just a quick overview about some of the 10 most common misconceptions when it comes to addiction. Hopefully challenging these misconceptions and learning more about them can help for us to change the stigma that is associated with addiction and treating mental health challenges. So thank you guys so much for listening with me today. Bye.